Hi, Amy. It's good to see you.
Hi, good to see you too.
How you doing? Okay, great. So do you have your completed ACORN form for me?
Yeah.
Perfect. All right, you want to step back here and we can look this over?
Yeah.
Okay, so let's take a look at what you got here.
Okay.
I see you've been having some trouble sleeping. What's going on there?
I don't know. I've been really worried this week. I've just got a lot going on, and I can't just sit down and relax without thinking about my problems. I have a hard time falling asleep, and when I do, I just wake back up worrying about the same problems.
And you know, that's totally understandable. Remember the sleep routine that we talked about? Try and take that 15 minutes of the relaxation exercise before going to bed. And if you stay in line with that, it should help you fall asleep.
Okay.
Why don't we take a look at how your sleep's been going over time? If we want to look at the graph here on the computer.
Yep.
I want to tell you a little bit about what you see here on the graph. This black line with the dots is called your global distress score. It's the average of your answers on each of the questionnaires you fill out when you come in.
Okay.
And then this purple line is called the projected change. And what that means is how people with similar demographics like age, gender, diagnosis, etc. improved over time. This green line is called the clinical boundary. People who score above the green line have more distress and most likely have a diagnosis with the need for support, like counseling. People who fall below the green line have less distress and most likely don't have a diagnosis or can manage daily stressors on their own with less need for support.
Okay.
And then we can add other colors, like we were talking about your sleep, for example. We can add this symptoms domain to the graph to see how that's been going. But before we do this, does this make sense so far?
So is down good or bad?
We don't like to think of it as good or bad. It's just a snapshot of how you're doing at the time. It gives us information to help you better. You know, we all have times when we are struggling more and times when things are going a lot better. And this line here reflects that.
Okay.
So the times when everything seems to be going better, that line's going to be going down. And times when you struggle more, that line's going to be going up. Okay? We use this information to help you better. You know, all these tools that we're using are here in place to help you get feeling better. And this graph just reflects those ups and downs so we can manage them more effectively. Now, if we add your symptoms to the graph, it looks like your symptoms aren't bothering you like they used to, and that's great. And actually, it looks like your symptoms reduced the most between the first and second time you filled out the ACORN form. Okay, so do you remember what was happening around that time in late October by that second appointment that was working so well for you?
Yeah, it just felt nice being able to talk to someone. My meds were on a good schedule, and I was having lunch with a friend every week.
Okay, perfect. And we've talked about how those are things that have been really effective for you. Getting your meds on the right schedule and then maintaining those positive connections with your friends are things that have worked out really well for you in the past. And isn't it nice how the graph works like that? We're able to identify a starting point and see what was going on, and that helped us identify what was working for you and what doesn't. Okay, now let's look at another area and see if we can discover some more things from the graph. Let's add substance abuse here.
Okay.
Because this line goes down, that tells me that you've been drinking less. Does that sound right?
Yeah, that's true. I haven't had a drink in the last week, and I've been attending my AA meetings.
Okay, that's great. And we can see that that's something that's been working for you. Let's remember that when you've been going to the AA meetings, the line has been going down. Maybe we should add these AA meetings to your personal care plan. Okay? And that's another way the graph is going to work for us. When we can see what's making the line go up and down, we can adapt to suit your needs and help you better. So it tells us something, and then we figure out from there what's causing that change in the graph. So with conversations like this, we can figure out what's working for you and what's not working for you in your life.